I call this routine spring cleaning. It has a lot to do with the wood element, which is the springtime in nature, and it has a lot to do with detoxifying, getting gunk out of our system. So it's our spring cleaning. And so we're going to start on the Liver Meridian, which is in between the first and second toe. It begins at the corner, outside corner of the toenail. So we'll start there with poking our fingernails into that point. In the movies and things, you'll see like somebody's dying and they'll smack them, come back, you. What they would do in the East is they would bleed these points. We could just do a little pain into that, and it's kind of like slapping somebody around. I would say in a healthier version of that. This point is called great esteem. And so liver, gallbladder, wood element has a lot to do with organization and structure of our lives. When a person is aligned with their divine plan, or higher purpose, you might say, we move forward with great esteem. And that is what this is giving to us. It's waking up that divine plan within us. And then we're going to go to liver 2 and then up here to liver 3. So this is right at the web of the toes. Liver 2, this is called walk between. And so it kind of refers to like avoiding obstacles, maneuvering around obstacles in our path. And poke in a little bit, get a little pressure, dig around a little bit. Like I can feel some real tenderness. And to me, that means that there's some big energy blocks there that aren't doing me any good. Like every day we have to walk between, we have to maneuver obstacles. And then liver 3, which we just keep going up until we bump into the bones, that's called supreme rushing. And it's kind of the energy of everybody rushing around to get to their places. The show's about to start. This gets all parts of us doing the right things. Our liver specifically should be helping our body to detoxify and create the structure of our body. The liver emulsifies fats, and fats are what we use to make cells. Every cell is made by a phospholipid bilayer. That means it's made of a wall of fat. So wood has to do with the structure of our life from the physical cellular level all the way up to our spiritual level. Then we're going to move up, feel the end of the ribs here. So from the very bottom rib that you feel, we put our knuckles right in under that and push in and create a little stimulation. It's okay just to do pressure also. I kind of like to get motion, but there are studies where they just press and hold and release, press and hold and release. So kind of test it out a little bit and see how it feels to you. And then we're going to go up to the bottom of the ribs, and we're going to put now the pads of our thumbs under our pec muscles on the ribs, and we're going to circular motion on those ribs. And we're hitting liver 14 and gallbladder 25. And these points have a lot to do with turning the page to the next chapter. There's one called chapter gate and one called cycle gate. So a chapter is the next part of the story, and the cycle is when we go all the way around, it's time to start over again. On some level, every day is a starting over. And so this gives us that energy. It's also called gate of hope, because it's a do-over. And perhaps every day we should be thinking about, if this is our do-over, what are we going to do better today? And then there's one point on the head. It's literally about an inch above the tip of your ear on both sides. And that is gallbladder 8. It's referred to as the hangover point. So you poison yourself and you feel like crap. And this is the point that you stimulate to make up for that error of judgment. You can look for the tenderness. And then for the knee pain, you're going to just explore the local points. Technically, you could just explore everywhere, but I did put dots so you could see where the most therapeutic points are. And you'll notice that there's this bone here, and then it drops into an indent. That's what you're always going to feel. And what you want to do is push into that, and you'll push against the bone, and you'll be touching attachments of tendons and ligaments, and you'll be able to find some tenderness, and then you massage across that. Same thing, there's that bone, you drop into a hole right there. Same thing over here, the bone, you drop into the hole underneath it, and wherever you find tenderness, you spend like 30 seconds or more. More is better. In post-surgical patients, they would press on one point for 15 minutes straight. But I also want it to fit into a busy lifestyle. I know you can't sit around and touch yourself all day. There's also 3 spots in the back of the leg, right in the very center, and then here, and up here. kind of above and below the kneecap on the lateral side. This is a pretty key point I want you to focus on. This bump here is called the fibular head. It's where this outside bone comes up and attaches into the knee. Find that prominence, drop forward and down a little bit, and that's gallbladder 34 in that indent right there. And this is a point that relaxes tendons and ligaments throughout the body, so it's a wide-acting point for pain. Same concept with the wrist. There's actually a study on carpal tunnel where they used this point and significantly relieved carpal tunnel symptoms and improved nerve conduction tests. I would just again explore local areas, front and back, and all the way around the wrist. But wherever it hurts too, there's points on the nails, you can pinch the nails. There's usually points in between the bones of the hand. Wherever you find tenderness, spend 30 seconds on that spot. And then just finish up with large intestine 4, which is right in the web of the thumb, right next to the bone, right there. That's the letting go point. Detoxifying, letting go of any crap, mind, body, or spirit. So whatever is toxic, whatever is not helpful, whatever is past, we let go of. Other side. And just set an intention to let go of something every day. I've suggested in clinic that we could all let go of being right, trying to look good. These are things that are not helpful to any of our human needs. Connection, significance, growth, trust, contribution, but whatever you need to let go of. And that's our sign for letting go, hanging on, letting go. Do that every day to clean all of this up, mind, body, spirit. This is a procedure that really comes from physical therapy to help with disc problems. And so when we put our spine into extension, it kind of pulls that disc forward so it's not jutting out the back and pushing on those nerves. Climb up on our elbows and just see what we feel. We're looking for a place, a position that feels about the best. Seems like, hey, you know what? That seems to relieve any pressure just holding like this. And we may have to walk my arms over this way. And then we could try a little bit of rotation, but just play with it as far as you can go. Let's try over here. Go into bending this direction and lift that arm up and lift up here. And if we find a good spot, let's hold it and kind of let your belly drop to the floor. So now we're just bracing with our arms, a little bit of rotation. Still feels like a stretch, but as far as pressure and discomfort, that feels the most comfortable. And we drop that belly down and we just breathe it out. Push the belly into the floor and just do several breaths in that position. And you can explore and see if there's other ones that feel good too. You can go up a little higher. We're going to try a full upward dog as well for all the points that it's getting in your low back. This is called child's pose. Pushing your chest as low as you can go. From there, we come up. Do at least 10 of those, holding at the ends of each movement. And it's okay if we have to stay with just the disc stretch on our elbows until we get it more stable, until we get those discs to align better. And then for the knees, I'm going to recommend backwards pulls. I'll show you a little demo of that. Just figure out a way to drag something backwards. Use a rope around your waist, connected to a weight or sled or basket, and just pull for at least a minute. And hopefully it's quick enough that you could actually pause and do this when you take your medicine morning and night, but at least once a day. Put some time into caring for your body.